Question 1. Which of the following terms describe when the presenting part reaches the level of the ischial spines? A. Descent B. Flexion C. Engagement D. Extension. Answer 1. C. Engagement is the mechanism whereby the fetus nestles into the pelvis. Engagement occurs when the presenting part reaches the level of the ischial spines. Question 2. The clinic nurse reads the results of a tuberculin skin test, TST, on a 3-year-old child. The results indicate an area of induration measuring 10 mm. The nurse should interpret these results as which finding? 1. Positive. 2. Negative. 3. Inconclusive. 4. Definitive and requiring a repeat test. Answer 2, A. Induration measuring 10 mm or more is considered to be a positive result in children younger than 4 years of age and in children with chronic illness or at high risk for exposure to tuberculosis. A reaction of 5 mm or more is considered to be a positive result for the highest risk groups, such as a child with an immunosuppressive condition or a child with human immunodeficiency virus, HIV, infection. A reaction of 15 mm or more is positive in children 4 years or older without any risk factor. Question 3. Sherry, with acute lymphocytic leukemia, suffers from nausea and headache. These clinical manifestations may indicate all of the following except, A. Effects of radiation. B. Chemotherapy side effects. C. Meningeal irritation. D. Gastric distention. Answer 3, D. Acute lymphocytic leukemia does not cause gastric distension. It does invade the central nervous system, and clients experience headaches and vomiting from meningeal irritation. The primary care provider and nurse practitioner may be responsible for follow-up after treatment and report back to the interprofessional team. Some effects of radiation and chemotherapy are nausea, vomiting, and headaches. Question 4. An increased myoglobin level suggests which of the following? A. Liver disease. B. Myocardial damage. C. Hypertension. D. Cancer. Answer 4, B. Detection of myoglobin is a diagnostic tool to determine whether myocardial damage has occurred. Myoglobin, an oxygen-carrying protein found in cardiac muscle and striated skeletal muscle. Myoglobin levels may be elevated in the serum within 1 hour after myocardial cell death, with peak levels reached within 4 to 6 hours. Question 5. Which of the following is not a types of health and physical assessments? A. Complete assessment. B. FAUST assessment. C. Follow-up assessment. D. Orientation assessment. Answer 5, D. Types of health and physical assessments includes, complete assessment, includes a complete health history and physical examination and forms a baseline database. Focused assessment, focuses on a limited or short-term problem, such as the client's complaint. Episodic/follow-up assessment, focuses on evaluating a client's progress. Emergency assessment, involves the rapid collection of data, often during the provision of life-saving measures. Question 6. The nurse is instructing a client how to perform a testicular self-examination, TSE. The nurse should explain that which is the best time to perform this exam? A. After a shower or bath. B. While standing to void. C. After having a bowel movement. D. While lying in bed before rising. Answer 6, A. The nurse needs to teach the client how to perform a TSE. The nurse should instruct the client to perform the exam on the same day each month. The nurse should also instruct the client that the best time to perform a TSC is after a shower or bath when the hands are warm and soapy and the scrotum is warm. Palpation is easier and the client will be better able to identify any abnormalities. Question 7. The type of abnormality where the umbilical cord is attached to membranes is called A. Battledore placenta, B. Filamentous placenta, C. Circumvallate placenta, D. Placenta marginata. Answer 7, B. Filamentous cord insertion is an umbilical cord attachment to the membranes surrounding the placenta instead of the central mass. Question 8. A simple and cost-effective method of reducing the risk of hypostatic pneumonia in a bedridden patient is A. Antibiotics, B. Nebulization, C. Frequent change of position, D. Humidified oxygen. Answer 8, C. Pulmonary congestion due to the stagnation of blood in the dependent portions of the lungs, in old persons or in those who are ill and lie in the same position for a long period is the reason for hypostatic pneumonia. Question 9. Most common cause of postpartum hemorrhage is A. Bleeding disorders, B. Placenta previa, C. Abruptio placenta, D. Atonic uterus. Answer 9, D. Atony of the uterus, also called uterine atony, is a serious condition that occurs after childbirth. It occurs when the uterus falls to contract after the delivery of the baby. And it can lead to a potentially life-threatening condition known as postpartum hemorrhage. Question 10. Which assessment following an amniotomy should be conducted first? A. Cervical dilation, B. Bladder distension, C. Fetal heart rate pattern, D. Maternal blood pressure. Answer 10, C. Fetal heart rate is assessed immediately after amniotomy, to detect any changes that may indicate cord compression or prolapse. When the membranes are ruptured, minimal vaginal examinations would be done because of the risk of infection. Bladder distension or maternal blood pressure would not be the first thing to check after an amniotomy. Question 11. What does AVPU stand for? A. Alert, voice, pain, unresponsive. B. Awake, voice, pain, unresponsive. C. Alive, voice, pinch, unresponsive. D. Asleep, voice, pain, unresponsive. Answer 11, A. The AVPU scale, an acronym from alert, verbal, pain, unresponsive, is a system by which healthcare professional can measure and record patients' level of consciousness. Question 12. The nurse is monitoring an infant with congenital heart disease closely for signs of heart failure, HF. The nurse should assess the infant for which early sign of HF? A. Pallor, B. Cough, C. Tachycardia, D. Slow and shallow breathing. Answer 12, C. HF is the inability of the heart to pump a sufficient amount of blood to meet the oxygen and metabolic needs of the body. The early signs of HF include tachycardia, tachypnea, profuse scalp sweating, fatigue and irritability, sudden weight gain, and respiratory distress. Question 13. The nurse reviews the laboratory results for a child with a suspected diagnosis of rheumatic fever, knowing that which laboratory study would assist in confirming the diagnosis? A. Immunoglobulin, B. Red blood cell count, C. White blood cell count, D. Antistreptyl isonotiter. Answer 13, D. Rheumatic fever is an inflammatory autoimmune disease that affects the connective tissues of the heart, joints, skin, blood vessels, and central nervous system. Recent streptococcal infection is confirmed by a positive anti-streptal isonode titer, streptosome assay, or anti-DNase-B assay. Question 14. A client with a chest injury has suffered flail chest. The nurse assesses the client for which most distinctive sign of flail chest? A. Cyanosis. B. Hypotension. C. Paradoxical chest movement. D. Dyspnea, especially on exhalation. Answer 14, C. Flail chest results from multiple rib fractures. This results in a floating section of ribs. Because this section is unattached to the rest of the bony rib cage, this segment results in paradoxical chest movement. This means that the force of inspiration pulls the fractured segment inward, while the rest of the chest expands. Similarly, during exhalation, the segment balloons outward while the rest of the chest moves inward. This is a characteristic sign of flail chest. Question 15. The nurse performs an admission assessment on a client with a diagnosis of tuberculosis. The nurse should check the results of which diagnostic test that will confirm this diagnosis? A. Chest X-ray. B. Bronchoscopy. C. Sputum culture. D. Tuberculin skin test. Answer 15, C. Tuberculosis is definitively diagnosed through culture and isolation of Mycobacterium tuberculosis. A presumptive diagnosis is made based on a tuberculin skin test, a sputum smear that is positive for acid-fast bacteria, a chest X-ray, and histological evidence of granulomatous disease on biopsy. Question 16. A client who is human immunodeficiency virus, HIV positive has had a tuberculin skin test, TST. The nurse notes a 7 mm area of induration at the site of the skin test and interprets the result as which finding? A. Positive. B. Negative. C. Inconclusive. D. Need for repeat testing. Answer 16, A. The client with HIV infection is considered to have positive results on tuberculin skin testing with an area of induration larger than 5 mm. The client without HIV is positive with an induration larger than 10 mm. The client with HIV is immunosuppressed, making a smaller area of induration positive for this type of client. Question 17. An oxygen delivery system is prescribed for a client with chronic obstructive pulmonary disease to deliver a precise oxygen concentration. Which oxygen delivery system would the nurse prepare for the client? A. Face tent. B. Venturi mask. C. Aerosol mask. D. Tracheostomy collar. Answer 17, C. The Venturi mask delivers the most accurate oxygen concentration. It is the best oxygen delivery system for the client with chronic airflow limitations such as chronic obstructive pulmonary disease, because it delivers a precise oxygen concentration. The face tint, aerosol mask, and tracheostomy collar are also high-flow oxygen delivery systems but most often are used to administer high humidity. Question 18. The nurse is taking the history of a client with occupational lung disease, silicosis. The nurse should assess whether the client wears which item during periods of exposure to silica particles? A. Mask. B. Gown. C. Gloves. D. Eye protection. Answer 18, A. Silicosis results from chronic, excessive inhalation of particles of free crystalline silica dust. The client should wear a mask to limit inhalation of this substance, which can cause restrictive lung disease after years of exposure. Question 19. The nurse is evaluating the status of a client who had a craniotomy 3 days ago. Which assessment finding would indicate that the client is developing meningitis as a complication of surgery? A. A negative Koenig's sign. B. Absence of knuckle rigidity. C. A positive Brudzinski's sign. D. A Glasgow Coma Scale score of 1. Answer 19, C. Signs of meningeal irritation compatible with meningitis include knuckle rigidity, a positive Brudzinski's sign, and positive Koenig's sign. Knuckle rigidity is characterized by a stiff neck and soreness, which is especially noticeable when the neck is flexed. Koenig's sign is positive when the client feels pain and spasm of the hamstring muscles when the leg is fully flexed at the knee and hip. Brudzinski's sign is positive when the client flexes the hips and knees in response to the nurse gently flexing the head and neck onto the chest. A Glasgow Coma Scale score of 15 is a perfect score and indicates that the client is awake and alert, with no neurological deficits. Question 20. The nurse is assessing the motor and sensory function of an unconscious client. The nurse should use which technique to test the client's peripheral response to pain? A. Sternal rub. B. Nail bed pressure. C. Pressure on the orbital rim. D. Squeezing of the sternocleidomastoid muscle. Answer 20, B. Nail bed pressure tests a basic motor and sensory peripheral response. Cerebral responses to pain are tested using a sternal rub, placing upward pressure on the orbital rim, or squeezing the clavicle or sternocleidomastoid muscle.